This is Pukeology Podcast, where science meets your hilarious puke stories and the tips and tricks to stop that up-chuckle that you need.
You never know what's going to spew out of her mouth. Here's
my mama,
Dr. Puke Nemo.
Who exactly is in charge of pregnancy across the world? Well, that's WHO, the World Health Organization. They're the ones that actually set standards for pregnancy, prenatal care, and basically a way to be able to get moms and babies to live healthy and happier. So learn what pregnancy recommendations are suggested by these pregnancy statistics. And I bet you they really do not know it. That's all coming up right now in Pregnancy Pukeology Podcast, episode 82, WHO Pregnancy Guidelines. Do you want no more morning sickness, pregnancy nausea, or how about no more upset stomach? Well, visit our sponsor, nomonausea.com, the only natural way to instantly stop your worst nausea, vomiting, or headaches, and get a 25% off code with the code PUKE25. That's PUKE25, or just place your No More Nausea band on your baby registry at Bye Bye Baby, or get it shipped for free in just 2 days as an Amazon Prime vendor. And know that your little ones are always taken care of, so you can actually find No More Nausea and No More Nausea Kids, plus No More Sleepless Nights Kids at your local Walmart store. So the sleep one also works for moms too, with little wrists, so they're available at your local Walmart store. Go check it out. So pregnancy humor that may just make you want to pee your pants, like you don't have to pee all the time being pregnant, with hilarious stories like sushi shot, strawberry festival thank you gift, and double dose at the same time. Now, if you want to learn more about your pregnancy, humor and knowledge is key to help you survive these 9 months. And just know we're in this together. Today, you will learn the science behind why WHO, the World Health Organization, recommends certain number of prenatal visits, pregnancy screening tests, and immunizations for pregnancy, including nutritional guidelines, especially for those women who have gestational diabetes. Learn all of this, plus the recommended time at which you can get pregnant for your next baby, all today in Pregnancy Pukeology Podcast 82, World Health Organization Guidelines for Pregnancy.
The science of puke, pukeology.
So who is WHO? The World Health Organization, it wants every single woman to have a healthy pregnancy and recommends a lot of incredible definitions that we have adopted as physicians across the nation in order to give the healthiest and happiest pregnancy you actually can. They also define a criteria for gestational diabetes, for pregnancy, for breastfeeding, and even WHO criteria for metabolic syndrome, which we'll talk about. Sometimes pregnancy may actually have some adverse effects. So I want to make sure that you take a look at all the information that's posed, the statistics, and look inside those pregnancy statistics, and we'll kind of dive into why they recommend each of these items. So the first thing is, according to the World Health Organization, about 303,000 women lost their lives in 2015 due to pregnancy complications. Furthermore, 2.6 billion cases of stillbirths, which a stillbirth, if you don't know, is actually when the mother delivers and unfortunately the baby has already been deceased or has already passed. And that was actually reported in the exact same year. So the above statistics were a real big wake-up call for us as physicians in pregnancy to establish a better prenatal, also known as antenatal, program that offers health promotions, screening diagnostics, and treatments of diseases that could have adverse outcomes in pregnancy. So read more about it. Again, you can actually go to WHO, World Health Organization, for more pregnancy recommendations. So let's jump right in. So the World Health Organization defines pregnancy or a positive pregnancy as maintaining physical and sociocultural normalities, maintaining healthy mothers and babies, preventing diseases and helping to treat them as well, illnesses and preventable deaths, having an effective transition from a positive labor and birth, and then again, achieving a positive motherhood, including maternal self-esteem, self-care, competence, and autonomy as a mom. Therefore, WHO released a comprehensive recommendation to help maintain healthy, positive pregnancies. The recommendations are taken into consideration in the antenatal nutrition, maternal and fetal assessment. Also, there are preventative measures. So those interventions are common symptoms of pregnancy and the system of how we're going to intervene in order to help improve quality care. The recommendations include the following. Pregnant women should start their antenatal clinic during the first 12 weeks and 7 other follow-ups. At 20, which we actually get to see the whole anatomy, which is really cool, and all that other good stuff. Usually they end up doing whether it's a gender, a boy, a girl, but they also do anatomy scans to make sure all the organ groups are growing appropriately. The 26th week, the 30th, 34th, and then now we get into the third trimester, or meaning when they are considered full term. 36 weeks to 40 weeks. So in those 36 weeks, 38 weeks, and 40. So remember, I know moms, we just want to kick out those babies, right? Because it's kind of uncomfortable to be pregnant. I've done it multiple times. But I will tell you that it's very important. They end up gaining weight, and their brains actually are doubling in size during those that last month. So really make sure you try to keep them in there and cooking as long as possible. All right. So also, they said that in early pregnancy, ultrasound is recommended before 24 weeks to establish the correct gestational age, identify multiple gestations, meaning twins, triplets, all that other good stuff, and fetal abnormalities. Screening for diseases such as HIV, malaria, tuberculosis, and Hep B is done during these visits. Now, women are encouraged, and I will say this over and over and over again, avoid tobacco. Don't smoke, don't be around smoke, even secondary or secondhand smoke, and again, don't use alcohol during your pregnancy. It is associated with very serious complications for the baby and the mother as they're trying to deliver, meaning you will see with excessive alcohol abuse or alcoholics as mothers that are pregnant, their babies tend to be very small. It's called intrauterine fetal retardation, meaning that they're actually very, very, very small. And also they'll find that they have issues and complications during their delivery. All right, so some of the problems and outcomes that we just talked about, low birth weight if you end up utilizing smoking or alcohol or anything like that, and also fetal alcohol syndrome, where the baby is actually an alcoholic and literally has to detox after they come out of the mother's womb. Now, pregnant women are also to be immunized. They actually give recommendations for immunizations and for different conditions such as tetanus. Okay, so what is the WHO's recommendation, or what do they say about gestational diabetes? So originally, gestational diabetes was actually defined as a fasting plasma glucose of over 7 millimole per liter, okay, or at 2 hour plasma glucose of over 11.1 millimolar per liter. So basically that just means the sugar is super high, whether or not they've actually had that super sugary drink and stuff like that. Now, if you're really curious about gestational diabetes, I will tell you that I did a podcast all on it. It's called Pregnancy Pukeology Podcast Episode 30, Gestational Diabetes. It will walk you through everything, what are considered normal ranges, and all of that. But recently, the WHO organization said, no, that's not good enough. So we're going to diagnose them as gestational diabetes if they have, in addition to that, one of the following: fasting plasma glucose of 5.1 to 6.9, a 1 hour plasma glucose of over 10, and then a 2 hour plasma glucose between 8.5 to 11, okay? So again, we basically made it broader, and we made sure to include more people because, remember, the diagnosis of gestational diabetes, which was adopted in 2013, positively impacted pregnancies and outcomes because, remember, 50%, let me say that again, 50% of pregnancy of women who have gestational diabetes actually get diabetes later on. That's considered type 2 diabetes. So the difference between the two, type 1 is where you were actually born with it, your inability to be able to produce insulin by the pancreas. And again, gestational diabetes and or type 2 diabetes is where, because of a certain circumstance, your pancreas isn't working as well, insulin isn't being able to be released, so the sugar can't be kind of compartmentalized. So instead, you just have all this sugar. And the problem with a lot of sugar, especially when it surrounds different neurological functions like nerves, you have decreased sensation. That's why a lot of diabetics, they can't feel when they step on something hard, or if they have a critter in their bed, and if somebody were to actually eat their toes off, they wouldn't be able to tell. So again, it's very scary. These are all of the things that we need to take a look at from not just a physician for babies, but also from the mother and what's to come afterwards. So again, 50% of women with gestational diabetes go on to develop type 2 diabetes. That astounding number should shock you. Again, you can lower your risk though after having a baby by maintaining a healthy body weight after delivery. So let's go into what the WHO criteria for metabolic syndrome. Metabolic syndrome is a group of conditions that occur together, which increases your risk or type of type 2 diabetes, heart disease, stroke, common conditions. They include things like high blood sugar, high blood pressure, abnormal cholesterol, high triglycerides, and the greatest risk factor is central obesity. Whoa. What is central obesity? Well, here, let me tell you. So it's basically where you have a bunch of fat around the middle of your body. If you think about it, it's kind of like what they call people that are apples, right? Apple shaped. And they actually say that, remember, we talked about why it's so important to maintain a healthy weight, not only during your pregnancy, but also whenever you deliver. And if you're curious, like, what is the right quote unquote weight you should be at, there's actually an entire podcast, if I can find it, that talks about your weight, and it talks about how much we should be. I will say that, remember, you really only need about 150 extra calories per day as a pregnant woman, and I can't find it, but if you look up Pregnancy Pukeology podcast, healthy weight, I bet you'll be able to find it before I can to tell you the actual thing. Alrighty, so what is the WHO criteria for metabolic syndrome? It's saying that the National Cholesterol Education Program Adult Treatment Panel, that's the third actually, ATP3 is what we're going to call it. They consist of 3 or more of the following: a fasting plasma glucose over 110 milligrams per deciliter. Number 2, serum triglycerides of over 150 milligrams per deciliter, or serum high lipids, or high cholesterol of less than 40. So remember, you have your good cholesterol and your bad cholesterol, so you'll understand how to kind of weigh that out. Number 4, blood pressure over 130/85, or blood pressure on medication. And again, number 5, your waist girth of over 102 centimeters. Now, basically that's saying you fat, you thick, you chunky around the waist side. And I'm not talking about during pregnancy. This is afterwards. So again, remember that, because you will grow and your belly will end up popping out during pregnancy. All right, so how long should I wait to get pregnant? Ooh, this is a good one. This is probably one of my favorite questions that my patients end up asking me, and that is the following. So it is recommended that you wait a period of time before giving birth again. They actually recommend that if you wait at least 24 months after having a live birth. So you need to wait 2 years in between your babies at least. The recommended interval for birth is 33 months, which means a little over 2.5 years. Now, a short birth interval, which is less than 18 months, or a long birth interval, which is more than 59 months, that's 5 years, just in case for you guys to quickly do math, between consecutive pregnancies are associated with different adverse pregnancy outcomes, such as premature rupture of membranes resulting in premature birth. Okay, so that's something that could happen if you have your babies too close together. Low birth weight of babies, uterine rupture, and eruption of the actual placenta. So some other causes of short birth intervals include shorter breastfeeding. Remember, when you're breastfeeding, it's not 100%, but you do have do not get pregnant, right? A birth control-ish method. It's not 100%, like I said, but those women who are breastfeeding tend to not get pregnant because it's almost like your body's saying, hey, I need to wait the 2 years to rejuvenate everything for my placenta to be ready for the next one. So not only shorter breastfeeding are causes or reasons for people to get pregnant really quick thereafter, but also having a previous female child, believe it or not. Girls, we cause you to end up having them again. Younger maternal age women, low level of education, and adverse outcomes to the previous pregnancy. All those things put together or combined together will be that fact that you could potentially be in danger or risk. So wait 2 years, ladies, before having the next one. That was a little intense with statistics. Let's get into some funny puke stories that may just make you want to pee your pants.
Throwing up on a Tuesday? One puke story.
All right, this one's a really good one from one of my listeners. All right, so once a month, my girlfriends do a ladies' night, and I was dying to go, but it was the first time I was pregnant. May I add that I was the first in the crew to get married and have a baby. I was craving sushi, but I had heard it wasn't a good idea, so I stuck with the cooked kind. I think my unborn baby read the same sushi, no sushi article, but the second I put that delicious roll near my mouth and I put it near my nose and into my mouth, it came shooting back up. I hurled all over the sushi boat, started crying, and my friends still laugh about it. Lauren Lamb, thank you for that hilarious puke story. Living in Central Florida, strawberry season is a thing. I got strawberry milkshake, a huge strawberry shortcake, and upgraded to get some vanilla ice cream on the cake. Looking back, I should have been put into a diabetic coma, but in no time, I managed to eat it all. My family was stunned, and I went to the parking lot super happy with my unborn child because that's exactly what he wanted. As I got to the car, my earring fell off, so I bent over to pick it up and felt the valve of my stomach explode. Everything that I just ate came up and dyed my white shoes red. Oh, this is so gross. What was even worse is that I wanted to go back inside and order it again because it tasted so good. Coming back up as it did going back down. Pregnancy cravings, you can't live with them, you can't live without them. Angie, but a thing. Thank you for that hilarious puke story. I love strawberry shortcake, but it doesn't make me want to eat it after that. Now, I got the rotavirus when I was 7 months pregnant. It was still by far the worst sickness I've ever had. Every time I vomit, it would come out with such force that my other hole had to match it. If you have never on the wall behind you when throwing up and stared at the brown stuff like a Warshaw psychology symbol out of exhaustion, you have never had the virus when pregnant. I literally couldn't control what was coming out of the top or bottom. It was so bad my husband still refuses to buy lemon-scented Lysol because he was the one cleaning it up after. Thanks, Tesh Kuhn, for that Virageddon story. Now, do you have a hilarious puke story that you just can't wait to share? Send it to me. Pukeology, Pukeology, at nomonausia.com. That's NOMONAUSEA.com. Or tweet me at Pukeology so we can all have a good laugh.
Tips and tricks to stop the up-chuckle that you need.
So nutritional guidelines by the World Health Organization, and they actually say that this will help to boost the pregnancy outcomes, and they include all pregnant women are encouraged to seek counseling about healthy eating habits, plus staying physically active. Do what you did before you got pregnant, even while that you're pregnant. Trust me, your baby can handle it. Just try not to within the first trimester. We say don't try to lift weights over 20 pounds because we have seen an increase in like bodybuilding, like that increased high weight reps with losing the actual baby during the first trimester. So you're a little more fragile, but again, keep up physical activity, stay healthy, and prevent excess weight gain. That's very, very important. A healthy diet provides energy, protein, vitamins, and minerals, and it includes green and orange vegetables, meats, fish, beans, fruit, and whole grains. Now, women, you guys should start gaining average gestational age, like actually a weight, after 20 weeks. So if you're sitting there worried and you're like, oh my gosh, I haven't gained any weight, it's okay, it's coming. So 20 weeks. Or if your doctor is saying, ooh, girl, slow it down, really take a look at what you're eating and what those calories are actually ingesting. It is also recommended that pregnant women take oral iron and folic acid. Folic acid is great to make sure that that there's no neural tubal defects, meaning there's no problems like spinal bifida is a perfect example. All right. So folic acid tablets, 30 to 60 micrograms of the elemental iron, which is 400 mics of folic acid to prevent maternal anemia, also sepsis, low birth weight, and preterm. Other recommended supplements include zinc, calcium, vitamin A, especially when those are from women in a region where these minerals are very deficient. Vitamin A offers, it actually is wonderful because it actually helps to prevent night blindness, while calcium is recommended to reduce developing high blood pressure during the pregnancy, which is a condition called preeclampsia. Now, what do they say about breastfeeding? WHO breastfeeding recommendations. Both WHO and UNICEF recommend that babies be breastfed within the first hour of birth and be exclusively breastfed for the first 6 months of life. Breast milk is ideal food for infants because it contains all the antibodies and protects them against childhood illnesses. They also go on to say that breastfeeding is one of the most effective ways to ensure your child's health and survival, but unfortunately only 3 in 5 children are breastfed within the first hour of life, and only 2 out of 3, which is about 41%, are exclusively breastfed for the first 6 months. Even with modern technology and a wealth of medical information, these rates have not improved in over 2 decades. Breastfed children perform better on intelligence tests and are less likely to be obese and less prone to diabetes later on in life. Did you know that breast milk provides all the energy and nutrients needed for the first 6 months of life exclusively? That nutritional value is half of that after 6 months to a year, and then drops to a third of the nutritional value after the second year of life. So WHO breastfeeding recommendations nearly could save 820,000 children a year. Bottom line, everyone needs the right to have a healthy and happy pregnancy. While we cannot predict the outcome, we want to make sure as doctors that we help you be the healthiest and happiest possible. Now you guys know what are the WHO recommendations for prenatal visits, for screening tests, immunizations, and pregnancy nutritional guidelines, plus diabetes facts that I bet you didn't know, and breastfeeding stuff. You learned all this today and more on this wonderful podcast. So if you love me, your favorite doctor, and if you love Pregnancy Pukeology podcast, let me know. Give me 5-star ratings or hearts for likes. Don't forget to download this episode, but more importantly, share it with all your prego friends. Thanks again for listening to Pregnancy Pukeology Podcast 82, WHO Pregnancy Recommendations and Guidelines.
Pukeology Podcast, edutainment at its finest.